you think women are prioritizing their health, or families are prioritizing women's health in general in India?
No, there's a big NO for that.
तो पैप स्मीयर और मैमोग्राम जैसे टेस्ट के बारे में पता है?
मैम पता तो नहीं है।
घर में फीमेल हेल्थ को कितना इम्पोर्टेंस दिया जाता है?
कुछ भी नहीं दिया जाता, कोई कुछ इम्पोर्टेंस नहीं, लेडीज का कोई वैल्यू नहीं होता है।
आपको वैसे कोई हेल्थ की प्रॉब्लम रही है कभी?
मैम काफ़ी रहती है एक्चुअली, थोड़ा सा नी में प्रॉब्लम रहता है और बैक पेन भी हो जाता है, वही नॉर्मल प्रॉब्लम्स रहती है।
आपके हस्बैंड कितने सपोर्टिव रहे उस टाइम पे?
उस टाइम पे तो बहुत सपोर्टिव रहे, मेरे फादर इन लॉ भी बहुत सपोर्टिव रहे उस टाइम पे। उसके बाद मतलब 3 या 4 डेज के बाद सब नॉर्मल हो जाता है कि हाँ वो ये पर्टिकुलर है, ये होगा सब। एक्चुअली मतलब जेंट्स लोगों के माइंड में फिट है कि लेडीज़ों को होता है, ये उनका है, ऐसे ही होगा।
आपने अपने जो हेल्थ चेकअप्स, चाहे वो मैमोग्राम्स हो या फिर पैप स्मीयर टेस्ट हो, जो कैंसर डिटेक्शन के लिए इनिशियल टेस्ट्स होते हैं, वो आपने कभी पहले सोचा है कराने के लिए?
नहीं, सोचा तो नहीं है क्योंकि अभी तक का तो ऐसा कोई इशू नहीं था।
आपको क्या लगता है फीमेल हेल्थ फैमिलीज में प्रायोरिटाइज की जाती है?
की जाती नहीं है लेकिन होनी चाहिए, की नहीं जाती है, हम खुद अपने पे ध्यान नहीं दे पाते हैं।
आपकी बेटियां हैं तो उनके वो कितने साल की हैं?
16
हाँ, तो वो बड़े अभी मतलब दे आर टीनेजर्स, सो हाउ डू यू एजुकेट देम अबाउट वुमेन सेक्सुअल हेल्थ एंड मेंस्ट्रुअल हेल्थ?
बिल्कुल ओपन माइंडेड है हमारी बेटी, हमारे हस्बैंड से भी बिल्कुल फ्रैंकली ये सारी बातें कर लेती है।
So how often do you get your checkups done?
I don't get these checkups done very frequently. So last time again, IHC had done it. We had come over it that time, and this time again I have come when IHC is doing it. I am not being able to take care of my things very regularly.
Have you done your pap smear and mammogram?
No, I haven't done it. That's what I have come to do here.
Okay, so this is the first time.
First time. Yes.
Do you know any of your friends who have been a victim of cancer or have fought cancer?
Yes, my own sister-in-law.
People, have you seen people coming here and actually getting detected like their cancer?
Yes, 100%. So you'll be surprised that in fact the statistic on that is very high. Very often, especially in breast cancer, there is no symptom, and there isn't necessarily also a history. But yet we see that people come and they've just come to get themselves checked because they're at a certain age, and there is a first level detection which happens. It's very natural for all of us to just put it in the back burner, right? Till the time you don't actually feel something, where very often invasions have already taken place in your body.
Female health is usually not prioritized, is seen as extra burden, economical burden. What are your expectations from the government apart from what it is already doing?
Well, government is doing some amount, they're taking more initiatives, but definitely having more awareness programs like this, like I said, putting the vaccination for cancer cervix on the immunization program. Because cervical cancer used to be the biggest cancer killer in women in our country. Now it's the second biggest cancer killer. Every 8 minutes there's a lady who's dying from it. So it should be on our national immunization program. It is there in many of the European countries, and I think it should be done.
Whether it's mammogram or pap smear,
Okay.
how frequently do
I would really feel it should be done every 3 to 6 months, but not a pap smear, but a checkup for a lady. But let's not get too greedy. I would say even once a year, if they go to their gynecologist or healthcare provider, get their tests done, get their pap smears done, depending on whether they're supposed to have it done, and their mammograms after a certain age, and see a gynecologist or a healthcare provider and get examined. That would be a good initiative. Once a year, I would say.
Well, finally, we are talking about menstrual health. We're talking about premenstrual syndrome or dysphoric disorder. Should women be given leave during those days? What is your view on that?
Good question. See, if they need leave, they should be given leave. I know of institutes that do, but my thing as a doctor, a gynecologist, that if they need leave during that period, then there's something wrong and they need to see the gynecologist, and it needs to be diagnosed why they need the leave. If it interferes with your quality of life, that means if you need a hot water bottle and you're resting in bed, or you have to take painkillers, then having pain, this is a myth that you talked about, during your period is not right, the amount of pain you're having. So you need to get that checked up and make sure that you don't have any problem there. So definitely, if they need leave, we need to be empathetic more than sympathetic. We need to be empathetic with them. We need to understand what we need to do, and that there are people who need that sort of care and empathy. But also for the ladies who need to take leave, if they're having that sort of pain, if they're having that sort of bleeding, please go straight away, see a gynecologist, and make sure everything is fine.
So there is no need to normalize the pain, right? That pop a pill and go to work.
No,
Yeah.
absolutely not. Never do that. That's the worst thing you can do.
Question: PCOD, ovarian cyst, and a lot of these issues are very common in urban women.
Okay, most important thing for anybody's health. You talked about PCOD. It's a lifestyle disorder. It's a lifestyle disease. We're sedentary. We don't go out and play. We don't eat healthy. And so, by and large, the norm for anybody, including a lady, is eat as healthy as you can, quote unquote, which means good composition of all the ingredients in this thing. Don't binge on anything and everything that you like. Exercise, get that body out, move it outside, not in the polluted air, but otherwise you need to exercise, both mental and physical exercise, and eat well.
Okay, and what will be your advice to women who are going through menopause and postmenopausal women?
We have to first understand that menopausal pregnancy, before periods, when you start getting your periods, these are all part and parcel of women's life. So you've got to make them understand this is not a disease. So menopause is not a disease, but you've got to tell them what are the things they need to know that are going to happen, the changes in their body, so they can be prepared for it, can adjust according to that, and not be anxious about it, and take whatever precautions they have to avoid those things. So that is something you need to know about menopause, that this is how it happens. These are the changes that the body is going to encounter. We need to be prepared for it, and we need to sort of take whatever precautions we can. Menopause is a normal state in a woman's life, and which will happen, and it means estrogen stopping, which means effects on various parts of the body, and like bone loss and stuff. So you need to see your healthcare provider who is going to continue with your journey along in your life, and then once you know about it, it's always easier to deal with it. So we do take these lectures. We'll have them at the Habitat also, I'm sure. I took one recently here. Come attend those, because then you'll be a little more prepared. And I think these are what we need to do, for women, all ages, all stages, including young girls who are starting out, 8 years, 10 years, school. They should know what they will encounter when they have their period. And the most important thing is getting that fear, anxiety. If you tell them what they will encounter, that fear, that anxiety in their brain, in their mind, which is detrimental, will get away.